India has an estimated 2 million people who are seriously in need of treatment for mental illness. Life, for most of them, is anything but a bed of roses. The mentally ill, without access to appropriate care and rehabilitation, are vulnerable to abuse and abandonment on account of unquestioned social stigmas and misconceptions about mental health.
If we take the totality of mental health services and access, only 20% of families will be accessing mental health care in the country. Those people who do not have mental health services will have severe disability burden. As a result, they fall through the safety networks of community to become homeless.
The question is, what leads to what? Does mental illness lead to homelessness? Or does the stress of being homeless lead to mental illness? Can homelessness be blamed on the lack of love or care by the family of the afflicted person? Or does one blame the general lack of awareness about the whys and wherefores of the disease? These are the areas of social conflict that require both institutional and community-based interventions. This is where organizations like the Banyan in Chennai act as catalysts for change. They fight to dislodge time-worn myths and misconceptions about mental illness and bring about an attitudinal change. They strive to improve access to mental health care and provide treatment that is compassionate and healing. Women who are mentally ill are rescued from the streets and brought to institutions like Adaikalam, a transit care facility in Chennai. There are 4 levels of dormitory accommodation, and the dormitory the patient is assigned to depends on the level of seriousness of the condition. The residents, as they are called at the Banyan, are transferred from one dorm to another as their condition improves. There is emphasis on bondage-free, positive, and individualized approach to the treatment. It is broadly divided into medical and psychiatric and can include psychotherapy, occupational therapy, vocational training, and assistance with legal procedures. Places of religious worship, like a shrine or this dargah, where often the family will bring a patient in the hope of divine help, illustrates the extreme vulnerability of people who are mentally ill. Team members of the Community Mental Health Project, CMHP, are sometimes able to persuade patients to seek treatment at the Banyan's Kovalam Center. This particular strategy makes good sense, as it seeks partnerships between traditional belief and modern medical practice. Each can give benefits that will help both patients and their anxious families. This community health center provides women who are mentally ill with proper institutional care and subsequently community care. Gajalakshmi, a community worker at the Kovalam Center, makes a home visit to Zina, a chronic schizophrenic. Gajalakshmi monitors her condition, provides prescribed medicines, and also counsels the family. Most patients who come to the Kovalam Center are from extremely poor families. An important outcome of the community project is the formation of a self-help group of caregivers that helps to mitigate the financial constraints of such families.
When Vaishnavi and I started about 15 years ago, we realized that people with mental illness who are on the streets and people with mental illness in general don't really have a future to look forward to. Even if you visit institutions, the focus really is on institutionalized care. It's not on a person's getting well, being productive and pursuing a life beyond mental illness. So that really was the seed of the Banyan.
Anuradha's is a winner story. She has successfully fought schizophrenia. She was trained at the CMHP Daycare Center to develop skills which have not only helped her earn a livelihood, but more importantly, have helped her regain her self-worth. Her story has inspired others at the center that they too are valuable and can stand on their own again.
வள்ளுவர் கோட்டம் ஸ்டால், பசந்த் உற்சவ் ஸ்டால், எல்லா இடத்துலையுமே எங்கள் ப்ராடக்ட் சேல் ஸ்டாலில் போட்டு சேல் பண்ணுறோம் எங்கள் ப்ராடக்ட்ஸு. லோன் 7,000 எதுக்கு எடுத்துருக்கிறேன்னா, இன்னொரு டேபிள் போட்டு அதில் வந்து நளினி, பத்மா இவங்களுக்கெல்லாம் ட்ரைனிங் கொடுத்து அவங்களையும் நல்லா இம்ப்ரூவ் பண்ணோம்.